Dr. Notley here, Winnipeg chiropractor and athletic therapist, and in this video I'm going to be teaching you 5 ways to self-myofascial release the muscles of the abdomen. The muscles of the abdomen are made up of 4 muscles. Rectus abdominis, which makes up our 6-pack, our external oblique, our internal oblique, and our transverse abdominis. To release the muscle, the rectus abdominis muscle, we have to remember its actions of the muscle. The rectus abdominis aids in flexing the spine, but it's also important for extending the spine. So what we do is we take a ball, we flex over that ball, place the ball, press it up against the muscle, and then from there you're going to extend backwards, arching backwards, resisting that arch by drawing the ball down towards our pubic bone. We can go through the entire muscle on both sides. Now there's another way to help release the rectus abdominis muscle, and that's to get more of the bottom part of the rectus abdominis closer to the pubic bone. So we take a ball. Now I've even done this with a kettlebell. You partially lay down onto the ball just above your pubic bone. In this case, I'm off to the left side. And what you do from there, you lift your leg up, and you'll feel it pulling down around the pubic bone. Again, contact it and lift up. The external oblique travels from our ribs down to our midline. Its action is to rotate to the opposite side, but also aid in side bending to the same side. So we're going to take a ball, or we can use our fingers. And we start by rotating and side bending to the same side, so everything's shortened. Grab hold of the ball or use your fingertips. We're going to rotate to the same side and side bend away. Find another spot, rotate to the same side, side bend the same way, and you can travel all the way out, around to the side. The internal oblique travels in the opposite direction of the external oblique. So the external oblique is what's called, it goes in the direction called a hand in pocket direction. The internal oblique is opposite hand in pocket. So it's traveling from the pelvis up towards the midline. So its action is to rotate to the same side, and it's also side bending to the same side. So again, we're going to take a ball, rotate to the same side, side bend to the same side. We're going to rotate away and side bend away, maybe a little bit of extension so we get that pull. Rotate away, side bend, extend, and you can work right through that muscle through there. We can also release the obliques on the side more effectively by remembering that the external and internal obliques aid in side bending to the same side. So what we do, we get to this, pin it up against the side of our abdomen. I'm going to side bend over it so I can get in there a little bit deeper. And then from there, I'm holding and I'm side bending away. I'm pushing my hips to the right as I'm side bending my body to the left. And I can explore a little bit to find different spots that we can stretch out. That's a good spot on me right now.